Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Research finds rapid glycemic control in gestational diabetes can reverse child's obesity risk. Swiftly achieving glycemic control after a diagnosis of gestational diabetes can bring the baby's risk obesity in childhood down to a level similar to that of children whose mother did not have gestational diabetes. These findings were presented at the annual meeting of the European Association for the Study of Diabetes in Madrid, Spain. Gestational diabetes, a type of diabetes that can develop during pregnancy, affects 14% of pregnant women globally and is becoming more common with those who are living with obesity, have a family history of diabetes, and are older at greater risk. It usually goes away after birth but carries a range of risks during and after pregnancy. Children are also at higher risk of cardiometabolic complications later in the life, including obesity and diabetes. Achieving glycemic control soon after a diagnosis of gestational diabetes and maintaining it through the pregnancy up to the delivery is associated with reduced rate of perinatal complications, says lead researcher Dr. Asia Mira Ferrara, director of the Center of Upstream Prevention of Adipose and Diabetes Mellitus Division of Research, Kaiser Permanente, North California, Oakland, California, USA. Treatments which include healthy diet, exercise, and blood sugar lowering medications aim to achieve optimal glycemic control, keep blood sugar in the normal range during pregnancy. However, the role of glycemic control on child's obesity has yet to be proven. High screen time linked to poorer language skills in children, study reveals. Screens have become ubiquitous in our daily lives, which means they have also become part of children's life too. So what effect does this have on children's developing brains, especially critical language skills? To understand this, scientists in Estonia surveyed the parents of more than 400 children about their screen use, their children's screen use, and their children's language skills. They found that parents who use screens a lot have children who use screens a lot, and that children's higher screen time is associated with poorer language skills. Our study reveals that children's screen time use patterns are similar to those of their parents, said Dr. Tija Tulvista of the University of Tartu, lead author of the study that is published in Frontiers in Developmental Psychology. Child language researchers emphasize the importance of everyday interactions with adults in early language development, where children are actively involved. At the same time, we know that all family members tend to their screen devices. Because time is finite, we need to find out how this fierce competition between face-to-face interactions and screen time affect child's language development. Clinical trial finds laughter as effective as eye drops for dry eyes. Laughter may be as effective as eye drops in improving symptoms of dry eyes disease, find a clinical trial published by the BMJ. The researchers suggest that the laughter exercise could be an initial treatment for relieving symptoms of dry eyes disease. Dry eye disease is a chronic condition estimated to affect around 360 million individuals worldwide. Common symptoms include uncomfortable, red, scratchy, or irritated eyes. But whether laughter therapy has a beneficial effect on dry eye disease is still unknown. To explore this further, researchers from China and the UK set out to assess the effectiveness and safety of laughter exercise in patients with symptoms of dry eye disease. Research finds semaglutide's cardiovascular benefit effective even in impaired kidney function patients. The anti-obesity medication semaglutide may help to prevent heart attacks, strokes, and other major adverse cardiovascular events, as well as death in adults with overweight or obesity who don't have diabetes, whether or not they also have impaired kidney function, according to new research presented at this year's annual meeting of the European Association of the Study of Diabetes, Madrid. The results are based on pre-specified analysis of the SELECT trials, which found that adults with overweight or obesity but not diabetes taking semaglutide for more than 3 years had a 20% lower risk of major adverse cardiovascular events or death due to cardiovascular disease and lost an average of 9.4% of their body weight. This new analysis found a similar percentage reduction in cardiovascular disease with semaglutide in those with and without poor kidney function in SELECT. Because those with poor kidney function have higher background risk of cardiovascular disease, the absolute benefit is greatest in this group, explained lead author Professor Helen Colquhoun from the University of Edinburgh, UK. She added, These findings have important clinical implications. People with impaired kidney function have increased risk of cardiovascular disease, and the results show that semaglutide is safe and effective in reducing this risk substantially. Unhealthy diet in fathers could raise heart disease risk for daughters. Study finds. Men who have an unhealthy, high cholesterol diet when they become fathers can cause increased risk of cardiovascular disease or CVD in their daughters, a University of California Riverside-led mouse study has found. The research published in the journal JCI Insight is the first to demonstrate the results seen only in female offspring. The CVD, the leading cause of death globally, is a group of disorders that affects the heart and blood vessels. Hypertension is a leading risk factor for CVD. It had been previously thought that sperm contribute only their genome during fertilization, said Chang-Cheng Zhou, a professor of biomedical research in the School of Medicine and the study's lead author. However, recent study by us and others have demonstrated that environmental exposures, including unhealthy diet, environmental toxicants, and stress can alter the RNA in sperm to mediate intergenerational inheritance. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.